wealth and not pieces of gold and silver. Today, the 22nd day in the month of August 2022, on the Zuma Talking Point, we're taking our time to take a look at health and how Nigerians can have access to health at a cost that will not send them to the poverty range or the poverty level in the society. But before we quickly go on to that, we must say a very happy birthday to a man, all right, who is what you call a friend of the house, okay? Dr. James Komolafe. Dr. James Komolafe is celebrating his birthday today. Of course, you did hear from him last week. He was one of our guests on the show last week. He's a year older, and we at Citizen FM, cast and crew, everyone here celebrate you, sir. We wish you many more beautiful, wonderful years ahead. Happy birthday to you once again from all of us at Citizen FM, Dr. James Komolafe. All right, we move on from that now. On the Zuma Talking Points today, we're looking at health, the NHIS, the NHIA, and all that it portends for Nigeria. My name is KEMI ASEKUN. My loved ones call me Kem. I like it that way. Recently, the National Assembly passed the NHIS bill, and Mr. President signed it into law to become an act. Now, by this act, the National Health Insurance Scheme Act of 1999 was repealed, and the National Health Insurance Authority was established. Now, the journey to this stage was a long, arduous one, but by this act recently signed into law by Mr. President, health insurance is now mandatory for all Nigerians. Now, this could mean that over 70% of Nigerians who pay for health out of pocket are who are sometimes thrown into poverty as a result of this will benefit from this national level of mandatory health insurance. And this morning I have in the studio with me a doctor of pharmacy. He has dedicated over 40 years to the medical industry in Nigeria. He is or was a foundation staff of the NHIS back in 1998. He rose up the ladder to become a director of planning, research and monitoring of the National Health Insurance Scheme in Nigeria. And although he is retired, he is not yet tired. I'd say welcome to the studio this morning, Dr. BODE Thomas ADEOYE.
Thank you, Kemi, for this wonderful invite that you've given to me. It's my pleasure.
Thank you for being here. It's important to let you know that he is a doctor of pharmacy. In recent times, Nigeria has been going through a challenge of brain drain, especially in the medical industry. For you as someone who decided not to jackpot, that is in our terms, what kept you back?
Wonderful, good question. Incidentally, my children had asked me a few times and said, "Daddy, you've taken us abroad. You were living abroad before we were born. Why did you not even, as you get back to us, why didn't you even stay over there?" And then I said to them, Nigeria had been good, yeah? And there was no issue at all. And I have always been employed. I had a good profession, pharmacy, and I just had no reason to stay out there. Without wanting to sound like over patriotism, the point was that I was fully engaged and I've always been engaged. If you can travel and go and come back, why you want to stay there? However, as a human being with the benefit of hindsight, maybe it would have been nicer for them to have opportunity of hanging out there
for the children,
okay. But certainly not for me. No, Nigeria is good and it will get better. It can only get better.
It can only get better.
Yes.
Well, it's good we have you on Citizen FM. That's what we preach here on Citizen FM, the fact that Nigeria is good and it can only get better. Let's look at the NHIS, which is actually our focus for this interview. But before we go into that, for many of the medical personnel who are just getting educated in Nigeria, looking forward to Jackpa that is leaving the country, what would you say to them?
Hey, they should just stay. They should just stay. There is always a better time. even if you go out there, you see, you are not fully a member of out there. You're not owned there. You're not as free as you are in Nigeria. And once Nigeria is up the beats again, you want to return, why up and down? Why don't you contribute? Stay here and contribute your quota. Each and every one of us has everything to do to make Nigeria better. It's not only the government, but individual citizens, like your name of your organization, citizen. You have to contribute your own and stay. I would not encourage them to continue to stay there. Yes.
But to come and contribute their quota here.
Come and contribute their quota here. And human resource has been a big issue. So why do we assist those who are already first developed, so to say, and then you rape us, you rip off, what you have to help our people in the localities and all of that. There is no need for them to stay out there. They should just come home and then we build it together.
Okay, and those who are home should also stay here.
Yes, of course, those who are home. I was, when I read in papers yesterday, a state was complaining that they were losing 4 nurses every day.
Wow.
And then I said, oh my. But at the end of the day, I know in the next 2, 3, 4, 5 years again, they will be wanting to return because something will get better in Nigeria.
Amen.
Yes.
Amen. Okay, so let's look at the fact that you're a foundation member of the NHIS. Sorry, excuse me, I have a slight flu, but we're taking care of it anyways. Okay, so let's look at the fact that you are a foundation member, you're right, of the NHIS. At the time when that was conceptualized, back in 1998, what was going on in the minds of those of you who became the foundation member? What was the whole idea about?
Oh, the whole idea was that a vision has to be created from a problem. The problem had been that Nigerians do not have access to health care. Why? Because they don't have the funds. So that they have this financial difficulty, barrier, in accessing health. And when NHIS was being muted, in fact, it has been muted since 1962, but then back and forth, 1997, it was now launched by the government of the day at the time. And then when we now joined the scheme, we now felt that we were really passionate at the beginning to ensure that we put a template in which we will catch up with other countries in the world that are running health insurance in some way, which makes it, a financial cover, for people, who could not actually have enough funds to access health care. Even if we have the geography, we can even access it because you have it around, you have the hospitals around. But where is the money? Where is the money? Because things have changed. If we just peep back into the 60s and before the 60s, health was free in Nigeria. We were in school and we go to dispensaries and everything was free. You go to general hospital, you don't have any, you just pick up your card. But as time went on, user charge came in because the money was no more sufficient, and then after that, full pay. And how will people be able to make a full pay when they don't have the money and they have many things to contend with? They have the house rent, they have every other thing. And so health insurance, when it came about and we joined, we said, no, we have to make sure that this template will work. And so we joined we started as a parastatal in 1997. I joined 98. And then all things have been working out, and it's getting better every day, even till now. For now, it's a wonderful thing that the government has signed, the bill, and it's now NHIA, National Health Insurance Authority, making it stronger, tougher, with big jobs to do.
Let's look at the metamorphosis from NHIS to NHIA. What has changed from it being NHIS, to NHIA?
Plenty things. Plenty things. Recall that NHIA was, became what it is a few months ago. So it's still 2022.
Yeah.
But what the provisions that were being put in the NHIA are revolutionary, if you want to say. For example, when NHIS was there, it was not mandatory. Now NHIA provides for compulsoriness for every Nigerian to be covered. That means 210 million Nigerians need and must be covered with one form of health insurance scheme or the other. So this is a great departure from what NHIS was. Granted that the struggle had been on for years to make this mandatory, but then it has come out. And so we say kudos to the present government and of course those who are running it today. That is one, mandatoriness. Number two, a great one provision of it is the provision for vulnerable group. Now, we all know that 60-80% of Nigerians actually live below poverty line, as they say, below 2 naira per day. And many of these people are vulnerable groups. Who are these people? Children, under 5, for example, pregnant women, for example, even the aged above 64, 65, also part of it, and then the indigent. So with almost about 83 million Nigerians banded together as vulnerable, the law as of now provides that this group of people, 83 million people, must be covered. So they don't need to pay for health insurance entry. All they need to do is for them to register, and NHIA, we provide all of the enabling environment for them to be registered, and then a lot of financing structure were enunciated in NHIA to ensure that there's enough funds, there will be enough funds to actually cater for this vulnerable group. So these are revolutionary, this time around. If you want to see.
Let's look at the fact that it's now mandatory. How will this possibly be implemented? What if someone says, I don't want to be on the NHIA, I don't want to be on the NHIA scheme, okay? As a Nigerian, how will this, pan out?
Of course, human rights is there. If you say you don't want to do, but the government says it's compulsory, because your ill health, your not being healthy, can affect another person, in some way. And so government, of course, we take it up, in graduation, starting from maybe people in the public sector. We're talking about the people in the formal sector, whether in the public or in the private sector. They will all be ensured to be covered, because it will be compulsory for them, for their employers to register them. And so those ones will easily get captured. And then you now move to the states, where all the 36 states and FCT all have their own social health insurance schemes. They will also be doing their best to ensure that the staffers, in their various states will be covered. So, in a graduated format, it will be trickling down to the vulnerable. Of course, somebody says they give you food to eat and you say you don't want to eat the food, okay. But then we know that with time, when you see things are going on, those who are eating the food, those who are getting the benefit of healthcare without actually suffering financial catastrophe, they will come into it over time.
Okay, now let's look at the HMOs in line with this new NHI Act, right? Where do the HMOs, that's the health maintenance organizations, where do they fit in the larger picture of all of this?
Oh yes, the NHIA still provides for the presence, the registration, accreditation of HMOs. So they are not, they don't have, there's no problem about their role, as it were, in NHIS and what it is now in NHIA. So they are still there. But NHIA has also expanded further roles to have what you call the TPAs.
What's that?
Third-party administrators.
Okay.
Yeah. These people will be given the roles of, quality assurance to make sure that the services provided are of quality, and then they also do quite a lot of patient satisfactions to make sure that people are satisfied with what they get. So that those are the function of the TPAs or any other thing that they give to them. So the role of the HMOs, as you said, they're all there as enunciated in the law. They're still going to be collecting contributions. They're going to be paying and doing all other things that they were doing before. However, I want to believe that new guidelines will come out. Because this is a new act. So I believe that the current managers of the scheme will be working very hard to churn out the various operational guidelines that will show clearly, the functions of each, and for the betterment of the coverage.
You're listening to Citizen FM 93.7. This is the Zuma talking point. Of course, this is where we bring in a guest, to enlighten the citizens, you and I, on how the things that we need to know for a better nation. And today it's about health. And we have we've been speaking with Dr. BODE Thomas ADEOYE, who is a foundational staff of the NHIS back then, even though it's now at the NHIA, all right? He has retired, but he's a doctor of pharmacy, dedicating over 40 years of his life to the medical industry here in Nigeria. And we are looking at the NHIA, what it portends for citizens, how citizens can take advantage of it. We'll take a quick break, and when we do come back, it will be time to delve more. How can the citizens, get registered? What do they need to do? And all of that. If you stay with us after this timeout, you will get to hear all of that and a little bit more. Once upon a time.
Is our journey. We have had our finest moments and our darkest hours. Yet we pull ourselves back from the brink every time. We are a resilient people. We are Nigeria. And when we talk, we share our views on Top Radio 93.7, Citizen FM. A people united will never be defeated.
Once upon a time, for one village where they for air, everything they go well. Them they enjoy better things until them great grandpillar them tell them say he get one secret where they for inside calabash, for inside bush. Elders them gather, them send them more inter bush. Impact in Ngongo and Njanja take enter inside bush. When you see the calabash, where them papa hide for inside bush. Time to open the calabash. more hard than knack. Last, in open the calabash. What's in me the secret where you come see?
As we bring them out, Abuja how far? Hashtag man up, tab yarns, mind your language. That's here, and the plenty gadget betterment mixed with correct Niger song. Now them they inside Evening Your Love with SMO1 Radio Street Breeze for 93.7 Citizen FM Abuja. Flex Evening Your Love Monday to Friday from 5 o'clock for evening go reach 9 o'clock for night. Evening Your Love with SMO1 for 93.7 Citizen FM.
Citizen FM. Citizen FM.
Well, of Welcome back, and thank you for staying with us. You're listening to Citizen FM 93.7, and this is the Zuma Talking Point, where we bring you issues that citizens can benefit from as we bring in guests who will help us look at that critically. This morning on the Zuma Talking Point, we have been speaking with Dr. BODE Thomas ADEOYE, who is a doctor of pharmacy, and that's like steps, beyond just being a pharmacist, okay? He's committed over 40 years of his life to the medical industry here in Nigeria, and we are looking at the NHIS. The NHIA. I keep saying NHIS, okay? Thank you for staying with us, Doctor.
Thank you.
All right, let's look at citizens now. How can citizens take advantage of this NHIA, those who are interested, even though it's now mandatory?
Fantastic. This is the crux. An enabling environment has been provided. NHIA, the act is there. And it has been operating for some years now. So there's a lot of experience on ground. The citizens are just simply expected to just agree to join, knowing fully well that they have been suffering financial difficulties in accessing care. Now, this is a potpourri that has been provided for you to come, for every Nigerian, for every citizen to come.
How do they get on it, and what are the advantages?
Right. How do they get on it? First, the NHIA authority, they have already instituted many programs through which different sectors of the country can log in. For example, you have the public sector, which is like if you're working in the federal government or the state government and all of that. All you need to do is just get your employers will enroll you easily.
Okay.
Now, that is again compulsorily. Now, if you're not in the public sector and you're in the private sector, organized private sector, let's say you work with Julius Berger or something, or Sheraton or all, your organizations, your employers must enroll you.
Okay.
Again, compulsorily. Now, if you are not in any of those employment,
Public or private,
you are on your own. Maybe you are not if you are vulnerable. If you belong to the vulnerable, which is like this 83 million people, then all you need to do is just walk down to NHI's office, which are there in all the 36 plus one, all over the country. Yes, and then the NHIS headquarters here, which is the NHIA headquarters, and then you just go there, and then you pick up the form, and then you just apply. That's all
for free.
Well, of course.
But how do you determine who is vulnerable and who is not?
Yes, the authority, like I said, will be working on arranging these people who are vulnerable. I have just told you they consist of those who are pregnant.
Okay.
So at least you know that if you are pregnant, you are vulnerable.
Okay. And so if you are pregnant,
yes,
and your family can afford to take care of you, you're still vulnerable.
Again, that is why, that's a nice one. That's why we say, okay, there are some vulnerables that are not necessarily they have the capability to pay or not to pay.
Okay.
So if you are pregnant and you can pay, if you like, you want to go, you go. But of course, the point is that there are those who cannot pay.
Absolutely.
Yes.
Absolutely.
So that is for pregnant people. And then on the five children, which is more than 17% of the population, those ones do they even know when they are ill more than they are crying? The parents, so everybody is there, oh, my children, these people, what is wrong? And all of that, you enroll them. You just go to NHIS and you get them enrolled. Okay. And the same thing, that is, if you are, and then over age, that is 63, 4, 5 and above, again, that's aged, you can also get enrolled. And then if you are an indigent, that is, again, the NHIA will be defining for us who is really an indigent.
Okay.
I'm not in a position for now to say exactly how the classifications or parameters to determine what an indigent person is. But besides this, if you are normal person, you are not necessarily vulnerable, and you want to join, there is a program called Gift Mix, Gift Ship, Gift Ship, GIF, group, individual, family, ship, social health insurance program. Now, that program is there. If you are an individual, and you can just walk there and then go to the scheme, go to the NHIS, and you pick up registration form, and then you just fill the form, and then you are up on it. The amount is there. I know of 45,000 naira as an individual. You don't have a wife, you don't have a child. You know, it's 45,000 naira through the gift ship program. Yeah, but then if you are in a group, or let's say a family of 6, that is family of 4, one man, wife, and 2 children. That one is 60,000 naira.
Now this I want to get a bit enlightened on this gift ship you have said. This 45,000 is for how long per month?
No, it's for a year. It's per annum. 45,000 naira per annum. If you divide by 12, that's less than 3,000 naira.
What are the advantages that come with this?
The benefits are big. You have the opportunity to access all forms of care at the primary level. Primary level means you go to the hospital, you see your doctor, you can see your doctor, and then they can keep you, for an outpatient requirement, level. But then if your condition warrants you to see a specialist, you have the opportunity to see a specialist as well. That is part of the package. That is through the secondary level, and then even up to the tertiary level.
that level, if you're seeing any of these people, you're not going to pay anything again, is it?
You will not pay anything again. What you will, after you have been treated, only the drugs that you are given, you're going to pay 10% of that. 10% of the drugs you are given, not 10% of the treatment. 10% of the drugs.
So you're not even paying for treatment again?
No, because you have made a prepayment.
Nigerians will say, me I'm sick, I don't fall sick.
Yeah, that is always the issue. But when the illness comes, it becomes not only your problem, becomes your family problem, becomes a societal problem, and then at the end, if you are not well, you are not, is only all the country suffers, because your when you are not well, you cannot produce. And it is your production that is part of the GDP, what everybody
gross
calls
domestic product.
Exactly, the only came, So if you do not get well, then the country suffers at the end of it all. So it is always good for people to actually log in either as an individual or as a family member, or if you are in a group, let's say you have your company, your citizen FM. You have at least more than 10 staff, then all your people will be enrolled by your employer at the rate of 15,000 naira only.
Per person.
Per person.
Wow.
For a year.
All
right. So they will pay for her 15,000, your producer 15,000, and so on and so on. As a group, if you are up to 10. All right. And this is why it is going to be cheaper. You can imagine what is 15,000 naira as compared to possibility of an illness when it strikes. Even if you're going to buy, look at what you're going to buy. If you want to buy anti-malarials, for example, it will cost you a lot of money. Maybe you're getting to that 15,000 naira, and illness can come once, can come twice, can come thrice, depending on who you are, your body systems, and all of that. So at the end of the day, NHIA actually gives you a wonderful coverage, primary, secondary, and tertiary. Once you go through this,
let's look at the benefits. Let's look at the benefits on the secondary level. What benefits do the individuals the citizens stand to gain if they log on to this mandatory program that a lot of people are yet to get on?
Secondary level 1, you can now see your specialist doctor. Yes.
Optometrist,
whether it is
OB/GYN and all of that,
or you're just going to see a physician or a GP or ENT and all of that. So you can see them. And then you can go through all of the many surgeries that may be slated for you, that you may need, that is going for surgery cases, surgical cases. And then, of course...
will that come at no cost?
At no cost. That is why it is so good that you go through health insurance, because and pay a little and yet you get a lot.
Okay.
You are paying according to your ability, and then you are going to have all of what you need to get you cured. And then NHIS or NHIA will not leave you until that quality is assured. That quality is guaranteed from beginning to the end. It's an end to end, so that you come out and you are well. And then, not only that, they will be doing researches, doing what we call satisfaction surveys to begin to find out, sampling, different people who have accessed care. How did you go? How was the attitude? What was the quality of medicines given to you? Did you feel fine? And all of that. So those things will be pulled together and used to improve the operations of the scheme. This is why some of those TPAs, the HMOs, they will be there as stakeholders who are actually ensuring that the treatment regimen goes well, from beginning to the end. Yeah.
If you're just joining us, well, you have missed a lot, but then you can still stay with us, because this is still 10 o'clock. Okay, and we're basically examining the NHIA and its benefits for citizens. And because we are Citizen FM, dedicated to a better you and a well citizen in Nigeria. Okay, we've been speaking with Dr. BODE Thomas ADEOYE, who is a foundation staff of the NHIS back then in 1998 when he joined them, even though it started in 1997, and they were part of those who put together some of the structures that have been worked on today to have the robust NHIA acts that we have today in Nigeria. It is really enlightening having you in the studio this morning, Dr. Thomas, Dr. ADEOYE. Okay,
yes.
Well, we move on with this NHIA thingy. For you, I know that it may be tough, but are there any demerits to this act?
No, absolutely none.
Why not?
Why should there be a demerit for something that is going to help the populace?
I wouldn't expect you to say there will be, actually.
No demerits. The issue is, it is to address the problems.
Okay.
So it cannot be a problem, and there cannot be a problem after a problem. Yeah. What were the issues? People could not access care. No money. No goodie. And then, so the idea of this NHIS, NHIA is to ensure that people are protected, financial cover. Protect you from financial catastrophes, so that you don't become poorer by looking for more money to maybe selling your house, selling your property, selling your grandfather's clock in order to have money, to access health care. And then when all of these are put together, we will be moving towards what we call universal health coverage.
Okay.
We'll be joining the rest of the world in trying to attain the big aim of ensuring UHC, Universal Health Coverage, for all Nigerians.
For all Nigerians. Before we continue, I want to take us back to what the coverage gives. Let's look at on the tertiary level, right? On the tertiary level, we've looked at the primary healthcare level, secondary healthcare level. At the tertiary healthcare level, at what points does the NHIA say, bring something from out of your own pockets too? We have tried.
Wonderful. Thank you. Good one. What I said to you about the secondary level coverage is the same, is replicated for the tertiary level. All of the many departmental needs, whether it's O&G or physician or ENT or something like that, they are all covered in that tertiary level. However, it's very difficult to say there will be provision to cover everything under this earth. Otherwise, there will no country will ever have the money to run it all. So there are a few exceptions, what we call exclusions, partial or total exclusions. Total exclusions will be like, if you are injuries from sports, extreme sports. I mean, if you are a mountain climber, things like that, and this is your choice to do this, that is not covered, for example. Then maybe partial covered could be like maybe when you need some diagnostic tests, like maybe you want to do, they ask you to do some CT scan,
laparoscopy, and all of that.
Laparoscopy, well, it's a wide area. Laparoscopy is checking things in the stomach.
Yes, maybe. No, I'm saying that if you have to do something that.
Yeah, maybe. No. There's more of diagnostics.
Okay.
Ultrasonography.
Okay.
Environment.
That's the scan.
Yes,
What is popularly called scan.
Scan. Particularly MRI, MRI, for example, then it will be split.
Okay. 50-50?
No, 20-80.
Who takes 20? Who takes 80?
The citizen, sorry, that sick person, unfortunately, will
client.
have to pay.
Who is taking 20? Who is taking 80?
The person who is taking 20 is the citizen. Is
20?
That enrollee?
That's fair.
20, and then the HMO pays the 80.
Oh, that's fair.
But there's also another good thing that has come up in the current NHIA, what they call this fund for catastrophic illnesses, cancer, for example. They have been able to arrange relationship with companies like Roche Nigeria Limited, that produces maybe anti-cancer drugs. And so they have arranged a distributive payment of 40, 50, 10.
Okay.
NHIS will be, or NHIA will be paying the 40% of a cancer patient, and then 50% of it will be paid by Roche, the manufacturer of that product, and 10% by the insuree. That is the enrollee.
Wow.
So that what could have been a no-go area before is now more accessible. Cancer, is also an issue all over the world. It's a big.
Let's take, for example, now that someone is listening to this program today and says, "Good, I'm going to enroll with the NHIS," pays the 45,000 and comes down with something, serious tomorrow. What happens?
No, that's what it depends on what has come up. Yeah.
But if you pay today, you have access today?
No, okay. Well, these are details of it now. This is an insurance. If you do not control it, the money can just run out. Okay. And once there's no money in insurance, this thing don't finish now. There's no more trust.
Absolutely.
So that's what is called waiting time. That if you pay for the 5,000 naira as an individual, you may not be able to access. You will not be able to access care until 90 days after,
which is 3 months. Plus or minus.
Yes. No, 90 days prompt.
3 months.
Is to ensure that during this period, administrations are being put
May I
together.
quickly ask 90 working days or just 90 days?
90 days.
Okay, so 3 months.
3 months, yes. 3 months. As after that you can access care. And the idea is just to prevent people from, to prevent what we call moral hazards, whereby, some people will just, okay, I'm sick, okay, I will just run go, all right, and all of that. So if you do like that, then you're going to have more sick people running into the system and
attempting to game the system,
exhausting the pool of resources available. So 90 days is put as a waiting time, and then after that you can access.
Okay.
Also, if there are surgical cases, that one will also take about 6 months, before you do that. So again, is to just regulate the system. You have to have a way of regulating the pool so that it doesn't run out.
So the best time to register for an NHIS is today.
Oh my, Kim, I would say you are just a great advocate of NHIA. It is today.
Okay.
Then you can be assured of coverage throughout the whole year.
Throughout the whole year.
After the 90 days waiting time.
After the 90 days waiting time. Well, This is Citizen FM 93.7. This is the Zuma Talking Point. My name is KEMI. Loved ones call me Kem. I like it that way. And we have been looking at health. A healthy nation is a wealthy nation. Like Dr. ADEOYE said, that if you are ill, you won't be able to contribute to the GDP of the nation. And you know that as a station, we are dedicated to the citizens, giving their best shot to everything, to everything that they do. And of course, we are very particular about the health of the citizens. That's why on the Zuma Talking Point today, this is our talking point with Dr. BODE Thomas ADEOYE, who happens to be one of the founding members, retired now, but not tired, dedicated, to enlightening Nigerians on the benefits of these acts so that we can take advantage. You did mention over the course of the program that individuals, the gift program, gift ship. Okay, yes. I want us to take a look at that. And with this, if a group of people, they're not bound by work, they're not bound by anything, they're just bound by, we want to do this gift ship. Can 10 of them just come together, go to an NHIS provider, and ask to be registered? What's the possibility of that?
It is possible. That is group.
Okay. So it doesn't matter whether it's a workplace or a private, whatever. If 10 people can just
go together, and they guarantee that the 10 will always be together.
Oh.
Yes, because all of these things are actuarially determined.
Okay.
And so those who do the calculations, the statistical calculations of money, today, money tomorrow, sickness today, sickness tomorrow, possibilities and all of that, probabilities, they have to know that, yes, this group has 10 people together. Okay. And then, let's say a church, for example.
All right.
Yes, or maybe a religious
organization.
You can leave that and, you join this church today, you join that church tomorrow and all of that. But if you're going to have that, it must be sure that this group will be together, so that this money will be expected to come
at the end of at the expiration of
exactly, so that you will fulfill what is called prepayment formality, because health insurance is prepayment, pay before service, pay before the thing happens, so that there is always money on ground, and money will be there to take care of those who come in and go, and come in and go. So hot money, will be hot all the time. Okay. And so this group must always be standardly together.
I'm glad that you mentioned insurance is prepayment. Nigerian citizens as a people, I am not sure, have a good way of taking advantage of insurance. I give you an example. You have a car and you can insure the car, and you can do a third-party insurance, right? For if you hit someone. There are very few Nigerians that will insure their own, I think it's first party or something. Comprehensive insurance. Okay. You have very few Nigerians that will do that. But because it is compulsory that if they stop you, whether VIO or police or anybody, they will ask you for your third party insurance, they will get to do that. What do you think can be done to awaken this idea of taking advantage of insurance in Nigerians?
Thank you very much. That's another good one. The issue has been that insurance has not been a common concept in Nigeria. It has been happening all over the world, even in some countries, Austria, Germany, all of these things more than 100 years ago. So, but this is a new arrival, so to say, in Nigeria, relatively. So people awareness is low. Awareness is low, and that is why NHIS is strengthened with this new act. In fact, what the act says is NHIS is to promote, to regulate. And when you are promoting, you are doing everything possible to ensure that the citizens actually understand it, they are aware of it, they know how to come into it, and then all of the stakeholders in the business, in the ecosystem, the health insurance ecosystems, will also be able to play their part and nobody is out cheating the other, and then you ensure there is sufficient, if you like, punishment, sanction, for those who breach the rules.
Absolutely.
So it's a problem. Yes, awareness, low awareness, and NHIA will continue to run on that track. Strengthened by this new law that is given to them. And we are also happy that the law also covers all the states, of the federation. So what is happening in Abuja is also happening in Sokoto, is also happening in Cross Rivers, and all of that together. So that as Nigerians, go into it and enjoy it, people will be coming out with people talk, testimonials.
Which is part of what you're doing today.
Again, this is part of what citizens are also put together here. Congratulations to them.
Thank you.
For doing this for NHIA, maybe
for citizens.
For citizens, as a matter of fact, yes. That is very correct. And
hopefully you would let them know that we have, even though I know you're retired from that agency, you let them know what we have done for them today, and they will do the needful.
Surely, because this is a versatile environment, a very active environment, and you have active listeners. I'm aware of that, and so more people will come in. And I can tell you, I will pass your message anyway.
Thank you very much. We look forward to that. Yes. It's 11 minutes to the end of the show. As a matter of fact, actually 6 minutes to the end of the show. I recall telling you that it's a 1 hour show, and you said 1 hour, and I told you would know how fast the time will fly. Well, so let's quickly look at this, because I'm looking at people coming together and deciding that they want to do this by themselves. You have the 10 people who would get to pay 15,000 as against 45,000. Yes. Okay, so now this 15,000, this kind of insurance cover, does it cover the person, the individual alone, or the individual and family members?
No, in this case, the individual alone.
Okay, so if it was a group and they wanted to do individual and family, what will that include?
Yeah, if it was a group, they will pay for the family bouquet.
Okay, and the family bouquet will cost how much?
Will be 60,000 naira for themselves and their wife and 2 children.
That's not fair now.
So 4 biologicals. No, it is cheaper.
No, let me explain.
Okay.
Let me explain. If as an individual you pay 45,000, right, per year.
Yes.
And if you come together as a group of individuals, you pay 15,000.
Yes.
Right?
Yes.
Now, if you come together as a group of individuals, 10, you now pay 60. Jebu, we don't do it like that.
No, if you go that way, then you will disrupt the plan.
The system.
Yes, you will disrupt the system. So that is why everything has its own
reasons.
Level,
So Ijebu doesn't come here.
Ijebu no come here, baby. Ijebu no come.
Okay. Well, time for us to coast home. I'd like us to look at the universal health coverage. For you who has been a foundation staff of the back then NHIS to the NHIA that it is today. If you had a crystal ball and you could look into Nigeria's future, right, when would you say health for all will be possible in Nigeria?
Wow. Thank you. As you said, it is crystal ball.
Yes, because you have been a part of. You have grown with it. You have even retired from that. You're still active, in informing the world about this, and that tells me that you are very passionate about health for all in Nigeria.
Indeed.
So, if you do have from what this act and this the NHIA authority has become, in your own side, coming from where you have come from since 1997, 98, and now 2022, when do you think this will be a possibility? Universal health for all.
Thank you. Again, very difficult to look at the crystal ball. We will look at things according to maybe a strategic plan.
Okay.
Do we have a strategic plan? Yes. NHIA has a strategic plan. From 2020 to 2030, 10-year plan. And within that 10-year plan, they have put a kind of a figure of like attaining 80%, by 2030. Yeah. So to that extent, I can tell you by 2030, the plan is to cover 80% of Nigerians. But let me tell you something. When it was launched, when former sector was launched, I was fortunate to be the head of the Department of Former Sector at the time, 2005, under Olusegun Obasanjo. And I recall that when the launching was taking place, Mr. President Obasanjo directed the Minister of Health that he gives him 10 years to ensure coverage of Nigerians, while the minister had announced like 20 years or so. Now, the president also said, give him 10 years. Now, now it didn't happen, but a lot of progress had been made. The point is, it's very, very political. It is health insurance, healthcare financing is extremely political.
Which is sad.
Yeah, no, political in the sense that the heads of government must, they take the lead. And depending on the political will, the political sagacity, the passion and all of that, that is one. Then also economic factors are there. The government of the day has a lot on its plate, competitive needs. So are these needs there? I mean, is the money available for all of this to meet all of these needs? So many considerations, stakeholders are also there, for and against, So you do a stakeholder analysis to see the powers, you see the influence, you see, so many things are at play to ensure universal health coverage. In the whole world, who has really achieved universal health coverage? Very few countries, maybe China is almost there, or come to Africa, maybe Rwanda was almost there, but also there are lots of ways in which they went about this. Probably not only getting money, contributions from the individuals, but also money from the partners. You need also the partners, to assist, in ensuring that the pot is full. And then, of course, sometimes you cannot control disease patterns. In the olden days, before the hypertension, cardiovascular issues, they are not much of a problem. But now they have become a big issue. Non-communicable diseases have now come in. So many factors are there, in place. So to do this, but start gazing the star will just be only spiritual. I'm unable to answer this one.
And being a scientist, you don't want to go through evidence that is not empirical.
Exactly. See, you are a scientist already. It's a nice one.
Thank you very much, Dr. BODE Thomas ADEOYE. I would have loved us to go through the fact that Nigeria doesn't suffer from a death of ideas, but a death of implementation. We have all the ideas; they're all on paper and all that, but we are hoping that as we grow as a country, we will pay more attention to what concerns the citizens and not our immediate selves, which is what will eventually make Nigeria a country that we can be proud of as the years go by, century into century.
Absolutely.
Very big thank you to you, Dr. BODE Thomas ADEOYE. I told you wouldn't know how long you wouldn't know when the time will fly by. I'm sure you want us to continue, but then we have come to the end.
Thank you very much. NHIS health insurance, Nigerians, please come and join. Yes, and be covered.
And that's our package this morning on the Zuma Talking Point on Citizen FM 93.7. Thank you so much for listening. Thank you so much for always tuning in. Tell a friend to tell a friend that this is where the citizens are covered with regards to all that concerns us all as Nigerians. Many thanks once again to my guests. Thanks to the backroom staff, the likes of Destiny, Damudu, Muna. Thank you for all you do behind the scenes. I'm KEMI ASEKUN. It's been a great pleasure being here again today, and by the grace of God, tomorrow we'll be back with another Zuma Talking Point, same time after the news update at 9. Do have a beautiful and an amazing week. But remember, there can be no happiness without good health, and I leave you in the hands of Harry Song with his song Happiness. Enjoy.